Every sport out there has its own unique set of injuries, and I'm going to show you how to take care of the ones that come from basketball and help prevent them in the future. Coming right up. Hey guys, my name is Ty Clark. I'm a licensed massage therapist. Now, if this is your first time to this channel, make sure you click that subscribe button and the bell icon. Now, before I say them, I want you to think or comment down below, what are the top 5 injuries that occur in basketball? Now, number 1, 42% of basketball injuries, ankle sprains. Number 2, also lower leg, and that's going to be Achilles tendinitis. Number 3 and 4 occur at the knee, and that's going to include patellar tendinitis and then injuries to the actual ligaments inside the knee. And then number 4, actually things like concussions and impact injuries. But we're going to focus on things like hamstring injuries. All right, let's jump right into that massage. I will spend a good chunk of time massaging the lower leg area since it seems to be the origin of most basketball injuries, and I always start out with some nice, warming, relaxing movement. Now, if they have an actual injury, I'm going to approach it a little bit differently, and if you want, you can watch the video above here if you want a more in-depth version of one for the lower leg. Now with massage, you're going to want to start broad to specific when massaging. So that means we're going to start with a muscle and then we'll end up working on the tendons. Most of the pain is felt at the ends of muscles at the tendon area, but we can't release those until the muscle is stretched out and lying flat. Many sprained ankles in basketball are a result of an accident, and if you don't release the surrounding scar tissue, the muscles, the fascia, it's much more likely to get injured again. Now I start with a nice, slow stroke down the calf muscle with an open fist. I actually go a lot slower than I'm showing you. I've sped it up a little bit. And then I like to use my forearm to help pull the fascia laterally. And this helps those lateral lower leg muscles like the peroneals and the soleus to separate from each other and just lie flat. These are muscles that tend to tighten up with the repetitive jumping and side-to-side movement in basketball. This is another way you can do it. I'm slowly pulling my elbows away from each other, and with gym I'm using my body weight, and this is going to be fine for male clients who have larger calves, but if you have somebody who is a smaller client, you're definitely going to want to use way less pressure, and calves tend to be really tender areas for most people. Now this is an amazing way to stretch out the overall fascial plane and any surface fascia that may be stuck. Applying deeper pressure can help affect those deeper layers. Now if they are having Achilles tendinitis problems, this is usually the magic spot. I would slowly hold my elbow in the center of that calf muscle and then move their foot for some passive release. You can also do this by having them hang their feet off the end of the table, or you can have them move the foot for you for some active release. Most basketballers have experienced at least one ankle sprain, and this is a great way to loosen up scar tissue from past injuries. Once a sprain has occurred, they're going to be really susceptible to another one. I really love doing Gua Sha here, and you can check out what that is in this video above, but cross friction is another great way to do this, and done over time warms up the tissue. It can release some of those adhesions. Most ankle sprains occur on the lateral or the outside ankle, but you want to make sure that you do both. Now this is another great way to release the tendons, especially the soleus tendons that are on both sides of that Achilles tendon. Pin and stretch the muscle by manipulating the foot. Then go ahead and give the Achilles some love too with that cross friction. Now if their Achilles is already inflamed, I would do this very minimally. The foot needs to have good mobility to absorb that repetitive jumping and running and cutting to the side. So we're going to want to smooth out and strip the arch here. One of the biggest problems I see in especially young ballers is that flat arch. which can be improved by releasing the muscles in simple arch building exercises. Flat arches can affect the power they have when jumping and controlling side-to-side movement. And if you watch them jump and their knees look like this, they probably need to have some arch work done. When an athlete has this condition called valgus knee or knock knee, it can cause MCL tears or just knee pain, and that can also be caused by tight internal hip rotators and adductors, and we're going to address those in a minute. Now we are going to switch over to some female legs for a minute, since I lost some other footage from the other massage. Hamstring strains are very common in basketball, and I would spend some time stripping the muscle here and stretching out the fascia with my elbow. Now when the hamstrings are tight, the tendon area around the knee can sometimes be mistaken for knee pain. I find this all the time, and I like to use my elbow to stretch out the fascia between the two bodies of the hamstring to help that. And then always make sure you give the hips some love. When hips are tight, it can affect knee alignment when they go to jump or run. Healthy muscles can fully stretch during extension. Glute medius and the lateral quads are super important when doing side-to-side movements, and sometimes that glute medius can get overworked and start misfiring. So I always make sure I take some time and get those to calm down and stretch out. Now the one muscle I find causes a lot of problems is the sartorius. This long muscle connects the hips to the internal knee, and when it's tight, it causes them to internally rotate and pull on the knee. I like to do some deep tissue on the quad and then focus on the inner thighs for the adductors. I really love a slow rolfing style because this is one of the deep tissue methods that will actually affect the fascia and will give you results that last. If they have pain on the medial side or the inner side of the knee, there is a really good chance that you can get rid of their pain by massaging the adductors or the inner thigh muscles. I wish I had $1 for every time this problem was called a meniscus tear or a ligament strain. So much of the time it's just those tight adductors pulling on the tendons. Massage up high and then do some cross friction on the ligament. You can do this all around the knee, which feels amazing. I have a family full of basketball players, and I'm always making them foam roll their quads so that these tendons don't get overly tight. This is a really good time to say hi to those inner calf muscles. This is a great position to massage them in. And you want to make sure that you remember them because these are some of the problem areas when it comes to Achilles tendinitis. That inner soleus gets stuck to the outside gastrocnemius, and you need to make sure that you disconnect them and see how that muscle is just hanging off of the bone. It is in the perfect position to massage. And also in this position, you want to massage the peroneals and some of the muscles in the front of the lower leg, just because they are usually involved in those ankle sprains, and it will be much appreciated. All right, that was a really condensed version of what I would do for a basketball massage. Make sure you check out my other videos.